Welcome back, students. Now this is a related question as we have learned in the previous video. Okay, the question is draw a diagram to show the horizontal tracing of peritoneum. In the last video we learned about the vertical tracing of the peritoneum. This is a video in which we are going to learn the horizontal tracing of the peritoneum, and this horizontal tracing of peritoneum will be presented in two positions, or two levels. First level is horizontal tracing or disposition of the peritoneum in supracolic compartment. The compartment which lies above the colon, transverse colon. And in the second diagram, I will trace the horizontal tracing of the peritoneum in the infracolic compartment. So there are two levels in which we will trace the horizontal tracing of this peritoneum. Let us see our previous diagram which we have learned in the last video. This is the transverse colon, and whatsoever lies above this transverse colon, above this is called as the supracolic compartment, and below the transverse colon is the infracolic compartment. It is the infracolic compartment. So the first tracing will be in the supracolic compartment, and this tracing will be passing through the liver, through the lesser omentum, and the posterior abdominal viscera. Here at this level is the kidney and the spleen lying in the just onto the posterior abdominal wall, upper part of the posterior. So the liver, lesser omentum, stomach, kidney and the spleen, this section will be passing. That is the supracolic compartment, right? Then the second section is through the infracolic compartment below the transverse colon, and this will pass somewhere here, which will cut the part of this lesser this sac, or the greater omentum, which is enclosed in the greater omentum. This will cut the mesentery of the small intestine and the posterior wall. I think it is below the level of the umbilicus. It will be below the level of the umbilicus, the infracolic compartment, which will cut the greater omentum enclosing the lesser sac, the mesentery of the small intestine, etc. So below the umbilicus will be our second section, that is from the infracolic compartment. After this introduction, let us come to the first disposition or the tracing, and the first tracing is at the supracolic compartment. This is the diagram to show you the tracing in the supracolic compartment, similar to our last video where vertical disposition was traced. We will again trace with the blue color most of the parietal peritoneum, as I said that there is no difference between the parietal and visceral because they are continuous with each other, and this transverse section in supracolic compartment will give you a better example that how a single tracing can trace all the part, visceral as well as the parietal peritoneum. But I will use two color here. I will red and the blue color. Not for the parietal or the visceral peritoneum, but I will differentiate with these two color the boundaries of the lesser sac and the boundaries of the greater sac, though these peritoneum are continuous with each other. Let us trace first the outer peritoneal reflection. And let us begin with the falciform ligament. You know what is falciform ligament? It is the double fold of the peritoneum which goes and reflect on the surface of the liver. See this falciform ligament, double layered, peritoneal fold, which after reaching to the liver will just trace, if you will trace, it will completely cover the liver at this section. See this? So the falciform from the right side, let me tell you the direction. This is the right side. Okay, RT means right side. This is the left side. This is the anterior side, and this is the posterior side where this lumbar vertebra is present, anterior side where the falciform ligament, and on the right side where the liver is present, and on the left side where the spleen is present. Okay, this way you can make out the directions of the section. Another thing which I want to say, that whenever you are seeing a cross section, okay, cross section is always seen as if you are standing towards the feet of the cadaver or the feet of a patient. Okay, so all the CAT scans, okay, computerized axial tomography or MRI, they are visualized in this way, thinking that your patient, though is lying onto the table, okay, in supine position, but then you are standing at the leg side and then seeing the cross section. So we are standing in this section at the leg side of the patient and seeing, and that's why the lumbar vertebra is placed here posteriorly, anterior abdominal wall, right side liver, and left side is the spleen. Okay, right. Let us see here. Okay, in this is, I have traced this. Okay, I have traced this section. Okay, I have traced this section. Okay, let us see this again. I will trace. Okay, again I will start from the falciform ligament itself. Okay, now from the falciform ligament we go towards the left side, and in this we will see that we are going towards the left side like this, and then it is covering to the anterior abdominal wall. Then it will come here, and then to the posterior abdominal wall, will cover the kidney from the front, and then it will reflect on till it will go to the apex of his spleen, then will go on to the diaphragmatic surface of the spleen, then again on to the anterior surface of the spleen, okay, or the colic impression, and then it will go here, from here to the anterior aspect of the stomach in cross section. Then it will go here to the anterior layer of the lesser omentum, because it is the lesser curvature of the stomach. This is the greater curvature of the stomach. This is the anterior surface, and this is the posterior surface of the stomach. And then here we will go, okay, here onto the right side. Okay, this will cover the three different structures, that is the hepatic artery, bile duct, and portal vein, which they lie on the free margin of the lesser omentum. This is the lesser omentum. Okay, I'm just lesser omentum. Okay, and this will come right up to this. I just leave it here. And trace it again from that of the right side, from falciform ligament. Okay, I can trace it here again, but I want to show you the difference between the greater and lesser sac. So I am first covering the greater sac. So I am tracing from the falciform ligament onto that of the right side, and then I am going here covering to that of the kidney. So the kidney lies retroperitoneally here. Then I cover here right up to the margin of the inferior vena cava. This is inferior vena cava, and this is the aorta. So most of the part of the greater sac, which is bounded by this peritoneum, which I have reflected in this blue color, is the greater sac. See this, it is written here greater. So I will set the greater sac, so it will become clear. From it is a quite an extensive sac. Okay, see, this is all where I am tracing. Okay, this is all the greater sac. Okay, this is all greater sac here. Greater sac is here. See this greater sac. Okay, this is the Now this blue shaded area is nothing but the greater sacc. So I have traced this area in the blue color starting from the falciform ligament. So this was a horizontal disposition. I left it here, okay, the right fold of the peritoneum or the right layer I have left onto the front of the inferior vena cava, and the blue line from the left side I left at the free margin of the lesser omentum, where these three structures, bile duct, hepatic artery and the portal veins are present. I left it purposefully. Now let us trace the boundaries of the lesser sacc. These were forming the boundaries of greater sacc. Now I will trace the same. It is the same peritoneum which was blue here, is continuous surrounding to the structures enclosed in the free margin of the lesser omentum, because this is the lesser omentum. And then here, this is the red color lining I am drawing. This is the posterior layer of lesser omentum, which is now covering to the posterior surface of the stomach, and then it will form a double layer or a double fold of peritoneum. And this fold of peritoneum is extending from the greater curvature. This was the lesser curvature. This is greater. It is extending from the greater curvature to the hilum of the spleen. Okay? And this will be called as gastrosplenic ligament. So I will just write it here, gastrosplenic. What does it mean? Gastrosplenic ligament. That is double fold of peritoneum, starting from the greater curvature of stomach, going right up to the hilum of spleen, forms the gastrosplenic ligament, and the arteries will pass through it. Okay, and then there will be, if you trace this further, this red line, it will go and form another double fold, which is now here covering to the anterior aspect of the spleen. Anterior aspect of the kidney. This is the kidney by the side of the lumbar vertebrae, okay, in the posterior abdomen. Okay, so this is the kidney. Now again, these are the double fold of peritoneum. See, one fold which is going toward spleen, another fold which is going and covering the anterior surface of the kidney. This two double fold will also contain the artery, and this fold is again a ligament, and this is called as the lino-renal ligament. Lino-renal ligament. Okay. Lino. Okay. Lino. I think the spelling may be wrong. Anyway, you check this spelling with that of the lino. L-I-E-N-O. L-I. I think it is L-I-E-N-O. Lino-renal ligament. Okay. So this is the lino-renal ligament. And this also the artery will be passing, okay, to supply the spleen, okay, branch of the splenic artery. Okay, so this is how the red line we are continuing here. Then it will cross the anterior aspect of the aorta, then it will cross the anterior aspect of the inferior vena cava, and will continue with this parietal, okay, which is covering to the anterior aspect of the kidney here, okay, that is the right kidney. It is covering to that of the right kidney here, okay. So this is the same peritoneal fold which is forming a single tracing, but here purposefully I have given the red lining and shaded it with the red color here, because this is the lesser sacc. This is our lesser, which we will see in the next video about the boundaries of the lesser sacc. And here is the structure, a narrow opening is there which is communicating the lesser sacc with this greater sacc. Okay, this whole greater sacc is communicated here with this opening, in which you can pass in your cadaver the finger just behind this three structure at the free margin of the lesser omentum. Okay, free margin of the lesser omentum. Just deep to it will lie the inferior vena cava. Okay, so you can pass your finger and feel the structures here. This is called as epiploic foramen. This arrow is indicating that from greater sac you are now going into the lesser sac. So it is the epiploic foramina. So this red shaded area is nothing but the lesser sac, and the blue shaded area is nothing but that of the greater sac is here. It is the greater sac is here. So that lesser sac is bounded here by this free margin, okay, in which these three structures are there. Then it is bounded by lesser omentum till the lesser curvature, then bounded by the posterior surface of the stomach, and on to the left side it is bounded by the two ligaments, gastrosplenic and lino-renal ligament, and posteriorly it is bounded where it is covering the anterior aspect of the kidney, aorta, and then the inferior vena cava. So these are the boundaries of the lesser sac in the supracolic compartment, okay, at the level of the spleen, okay, at the level of the spleen. So this is the epiploic foramina. This is the horizontal tracing, okay, in the supracolic compartment. Now let us come to the horizontal tracing in the infracolic compartment, and I have shown you the diagram, okay, from where just below the umbilicus, okay, infracolic compartment is below the umbilicus. And now here I can just orient you. This is the lumbar vertebra in the infracolic compartment. This is must be the fourth lumbar vertebrae, for example. These two are the ascending and the descending colon. On to the right side it is the ascending colon, okay, so this colon is the ascending colon, and on to the left side it is the descending colon is here, okay. So this is right and left side showing the ascending and descending colon. Here is the, what you see here is the this is the inferior vena cava. Let me have the blue color, okay. So this is the inferior vena cava in the same position as it was in the supracolic compartment. And this is the aorta in the same place as we have seen on to the left side, okay, in front of the lumbar vertebral body. So this is same inferior vena cava and that of the aorta, or that of the aorta. So this is the anterior abdominal wall here covered by the peritoneum, okay. And from the posterior wall there goes this mesentery of the small intestine. So this is the small intestine here. See this? Okay, and this is covered by the peritoneum, okay, mesentery. Let us trace this, and it is quite simple tracing. I will trace it with the blue color only here, right from the mesentery. This will go here, this layer of the mesentery, then it will wind round around the small intestine, will form the second layer of the mesentery. As mesentery is double layered, there is no gap, they are fused with each other. Just for understanding, I have drawn them away from each other. Then it will cover the anterior aspect of the descending aorta, and then you will see that this will cover the anterior aspect of the descending colon onto the left side, and then it will cover the anterolateral wall of the abdomen, okay, where the flat muscles are present. And here you will see many structures which are passing just in front of this parietal peritoneum, and I will name this, okay. So I have crossed the midline in reflection. Coming on to the right side, again it will cover the anterior aspect of the ascending colon, and then it will cover the inferior vena cava, and we will reach to the same place from where we began, okay. So what is this? This is enclosing nothing but the greater sac, which I am just shading with the blue color, okay, the whole thing. Okay, it is not empty, though it seems to be empty. It is full of the loops of the small intestine, okay. But then there is a structure here which I have shaded with the red color and given the name as the lesser sac. And lesser sac is enclosed within the greater omentum. Let us see this diagram, okay, for explanation. Now suppose this diagram below the umbilicus was passing like this. So this is passing through the four folds of the greater omentum, okay, in which this space is extending, and this space is called as the lesser sac. So this greater omentum cross section, okay, will enclose the space called as the lesser sac. Okay, so this is the lesser sac enclosed. Let me just draw the peritoneal reflection of the greater omentum. Outside, as we have seen, this is the layer number 1 as we have drawn in the vertical disposition, which becomes continuous as a posterior layer, that is layer number 4. So this is layer number 1, which become continuous as layer number 4, and then the layer number 2 here, which was forming the boundary of the lesser sac. Okay, this is here, this is the layer number 2, and this will continue as the layer number 3. Okay, it becomes continuous as the layer number 3. If you don't want to remember the numbers of the layer, just don't bother. So there a double fold peritoneum is on the anterior side of the greater omentum. This is the posterior side of the greater omentum, and enclosing a cavity is called as the lesser sac. So this is how the greater and lesser sacs are seen below the umbilicus in the infracolic compartment. Let us see some of the structures which are shown onto the anterior aspect of the peritoneum in the just deep to the muscles of the anterior, that is deep to the fascia transversalis, which lies deep to the transversus abdominis muscle. Okay, let us see quickly what are these structures. This is the median umbilical ligament. Okay, and this is obliterated urachus, which extend to the umbilical cord coming from the apex of the urinary bladder. Later on gets obliterated. So it is obliterated urachus and forms a ligament called as the median umbilical ligament, exactly present in midline, okay, in the median plane. Then lateral to it on either side are the other ligaments called as the lateral umbilical ligament. So this was the median umbilical ligament, not medial. It is median because it is single in midline. And this is the lateral umbilical ligament. And this ligament due to the obliteration of the umbilical artery, which carries the venous blood to the umbilical cord. Okay. So this is the lateral umbilical ligament, and it gets obliterated soon after birth. Okay, so this forms a oblique umbilical artery or lateral umbilical ligament, and still lateral to it on either side is the inferior epigastric vessel artery and that of the vein inferior, which lies just medial to the deep inguinal ring and runs towards the umbilicus, runs from the branch from the external iliac artery, So these are the structure which you are supposed to draw when there comes a horizontal section, okay, in the infracolic compartment. This is the easiest. Okay, this is the easiest. Just draw 1 or 2 times and you will master it. Okay, thank you very much for watching this video showing the sections or reflections of peritoneum in supracolic and that of the infracolic compartment.